This is Sharon Gould, working alongside Christopher Hill to bring potential solutions in making healthcare cost-effective and widespread. As technology advances and shapes the world, healthcare policy will undergo changes to meet the needs of patients near and far. With that, let's get introduced to the idea of telemedicine. So what is telemedicine? Telemedicine is the use of technology to deliver healthcare services such as diagnoses or treatment recommendations from a distance. It is an exciting and busy development in health technology. When we think of telemedicine today, we often imagine a patient consulting with a physician via a live video, asking questions and discussing treatment options. In basic forms, however, it has existed for decades. Phone calls to 911 or over-the-phone consultations with nurses or doctors are simple forms of telemedicine. Telemedicine started to be explored more seriously in the 1950s and 60s when medical images began being sent ship to shore and electrocardiograms were transmitted from paramedics to emergency rooms. Interest in telemedicine began to wane in the 1980s, but the field experienced a resurgence in the 90s due to improved technologies and lower costs. Today, there are various categories of telemedicine, including synchronous, asynchronous, remote patient monitoring, and mobile healthcare services. Now let's get more familiar with one of the more common instruments in telemedicine, the telemedicine cart. Telemedicine carts are mobile workstations available in hospitals and healthcare providers' offices that enable a patient to receive a diagnosis regardless of distance. With these carts, doctors are able to use the video conferencing features to request opinions of specialists who work in other locations. Depending on the brand of cart, features may vary, but generally, it's standard to find the workstation equipped with a camera, monitors, and simple diagnostic instruments such as digital scopes, vital sign monitors, or basic ultrasounds for easy and quick access to a diagnosis. Aside from being used in discussions, the cameras would allow for nurses to be able to send high-definition pictures or videos of the patient's injuries. Many of the carts are modular as well, and allow for easy mobility around the hospital and positioning in the case of patients who are in a bed or a wheelchair. So what are the benefits telemedicine carts can provide? A major benefit is efficiency. Telemedicine carts have been used by the Veterans Health Administration and the Indian Health Service to provide diagnoses and help in the management of chronic conditions, which has resulted in decreased wait times and shortened hospital stays. Another great advantage is the efficiency at which patients with rare diseases can be diagnosed. Patients would not have to be concerned with visiting multiple specialists in offices outside of the city. Now the doctor can consult several specialists from his office. Access is a huge advantage provided by telemedicine. It allows patients in remote and rural areas access to specialists they otherwise would not have been able to see. Telemedicine can also reduce costs by treating patients outside of a traditional clinical or hospital setting via shorter lengths of stays and avoiding unnecessary diagnostic tests. As mentioned before, telemedicine can be divided into two categories, synchronous and asynchronous. Synchronous telemedicine happens in real time, while asynchronous requires the patient to wait while the physician reviews data and then proceeds to make a diagnosis. Telemedicine carts are extremely versatile tools, allowing for both synchronous and asynchronous procedures. One of the strongest cases for these carts is the fact that the care is delivered in a synchronous manner, that is, the healthcare happens in real time. The video conferencing feature means doctors can discuss a patient's healthcare needs while you wait. However, telemedicine carts can also be used in an asynchronous fashion when they are used to collect images or video during a patient's exam, which are then sent to a specialist for analysis at a later time. What are the disadvantages? Because our current telemedicine technology is a relatively recent development in healthcare, it faces multiple challenges, many of which relate to laws and policies. Most states require physicians to be licensed in the state where their patient receives treatment. This complicates long-distance telemedicine, where the patient may reside in a location where a physician or specialist is not licensed. Although some states have begun to address this issue, there is still not a consensus on how this issue should be handled. Additionally, state laws and regulations can vary widely. For example, Some states require an in-person examination before treatment can be prescribed, while others do not. Furthermore, reimbursement for telemedicine services is inconsistent between states, and insurance reimbursement is likewise variable. A final disadvantage of these cards is the reliance on digital equipment. If there is a technological malfunction with a piece of equipment, or if the quality of an image or video is poor, it can be difficult to obtain an accurate diagnosis. What is the future of telemedicine and telemedicine cards? They will continue to evolve as new technology is developed and becomes cheaper. Soon-to-be innovations include the creation of telemedicine kits, which are tablet-sized monitors to be used in first-line patient exams. Patients can use iPod add-ons like stethoscopes or otoscopes in their own home while communicating with their physician, and telemedicine robots can be piloted by physicians hundreds of miles away from their patients for bedside conversations and consultations. Eventually, telemedicine carts may evolve into automated robots that can automatically begin opening patients' medical records or obtaining vital signs or automatically dispense medication. It is fair to state that telemedicine and telemedicine carts are an integral part of doctors' routines. Now that you are more informed as to the role of these carts and telemedicine in general, we want to hear from you. First, what changes need to occur before telemedicine becomes more widespread in the United States? And second, do you think telemedicine can supplant traditional healthcare? If yes, in what circumstances? And if no, why not?